welcome to my channel. Today's video I will be comparing the roles in the dental office. If you are looking to be a hygienist, a dental assistant, or a doctor, this video will be for you. Or if you're just interested in the different roles and responsibilities of clinicians in the dental office, keep watching. Currently, I'm a registered dental hygienist. I've been expanded duties dental assistant for 13 years. When I first got into the dental field, it was because I used to have a fear of going to the dentist and have treatment done. And one day I went to have fillings done as an adult, and the assistant helped me so much, and she was so kind, and she made me feel so comfortable in the dental office. And I was like, I want to do that. I want to help people that's afraid in the dental office. And at that time, I had no idea that there was a different person that assisted the doctor than the person that cleans the teeth than the doctor. I just thought of it as there was a doctor and then there were people that helped the doctor. So I went to school for dental assisting. About 6 months of working, I went back to get expanded duties certification. So that just allowed me to have more responsibility as a dental assistant. And recently I moved to another state to complete dental hygiene school. I'm currently a registered dental hygienist. I wanted to just compare the roles of each clinician in the office to kind of give you an idea of what your responsibilities would look like, what the schooling looks like, and what most importantly, the pay. So let's start with a dental assistant. The duties of the dental assistant are to be just that, to assist. So it could be assisting the doctor, assisting the hygienist, assisting up front. The main role of a dental assistant is going to be four-handed dentistry. So when the doctor does his or her procedures, the assistant is the one that sets up the room with all of the instruments that will be needed, cleans up the room once the procedure is done, passes the doctor the instruments, passes any type of materials that they may be using, take x-rays, sterilization of the instruments. So as a dental assistant, you will need to know the names of the instruments that the doctor will use. You will need to know the names of everything, because if your doctor asks for it and you don't know how to get it, you're kind of like embarrassed to say, well, what is that? Even though if you don't know, you have to ask, but your doctor is expecting you to know what every instrument is called, what all the dental materials are called. You basically need to know what your doctor needs before they even need it, before they even know they need it. For instance, say the doctor is doing a filling, you need to know the steps of doing a filling. You need to know that you need to etch that tooth, then you need to rinse it off. The doctor's going to dry it, then he's going to get ready to prepare that tooth. You need to know what material the doctor is going to use, and you pass that to the doctor to use it, and then you take it back when he's finished with it and you pass him the next thing, him or her. From the start of the appointment, once you bring the patient back, the dental assistant usually gets like the chief complaint or sets the patient up for the treatment for the day. They take any x-rays that may be needed so that the doctor can take a look at the tooth that's bothering them. Some assistants, for example, that work in the orthodontist office, where the doctor will usually not do general dentistry, such as like fillings, crowns, and those things. They're just doing braces or orthodontics. That assistant will probably just change bands every day, change the little rubber bands, do ligature wire, change the wires, taking x-rays, those sorts of things. So it also depends on what area of dentistry you're working in. Some states, you can go back to school for additional training to be expanded functions or expanded duties dental assistant, which I went back in my state, and that allowed me to do coronal polishing, which is when you polish the teeth with the little handpiece, dental sealants, placing gingival retraction cord. Some states, you're allowed to, as an expanded functions dental assistant, you're allowed to fill in the filling once the doctor has prepped the tooth and complete that filling. So it would depend on what state you were in, responsibilities that they allow you to do. And then lastly, dental assistants will usually be able to do whitening and monitoring the patient while they're on nitrous oxide, the laughing gas, and making temporary crowns for patients that will be needing to return for their permanent crown. Moving on to the dental hygienist in the dental office. The dental hygienist is the person that does your cleanings. The role of a dental hygienist includes taking x-rays, perio charting, which is measuring the pockets, depths around your teeth, oral cancer screenings, fluoride treatment, whitening, such as Zoom whitening, where you have the whitening gel placed on your teeth and you sit under the blue Zoom light. The hygienist is the person who treats gum disease and bone disease. They can provide antibiotic treatment. The dental hygienist can also do laser therapy to remove bacteria from underneath your gums. Scaling and root planning, which is removing calculus and tartar from the root surfaces of your tooth that's underneath the gum. Also able to anesthetize the teeth, that way that they can do their treatment and keep the patient comfortable. So basically they give shots. Dental hygienists are allowed to diagnose bone disease. Dental hygienists are also allowed to give nitrous oxide. So not only do they monitor, but they are allowed to administer. The dental hygienist does not diagnose caries. We are able to detect it with our instrument, and also we are taught to know what it looks like on an x-ray, but we are not allowed to diagnose caries. If we have a patient that we suspect has a caries, we would usually just let the doctor know for the doctor to actually diagnose that patient. The dental hygienist would do medical history review, blood pressure check, hand scaling with instruments to remove tartar and plaque, fluoride treatments, whitening, coronal polishing, sealing. The main purpose of a dental hygienist is to focus on preventative care. We are working with the patient to prevent gum disease and bone loss, to prevent caries. That's why I love the dental hygiene aspect of dentistry, because it's helping the patient before there is a problem. Dental hygienists can also go back to get certification to be expanded functions, where they will also be able to fill the tooth once the doctor has prepped it. Moving on to the dentist. The doctor, which is the dentist, focuses on restorative treatment. Once you have the caries, once you already have a cavity, the doctor fixes it. Depending on what specialty your doctor is, he restores. It can be an endodontist and he does root canals. It can be an orthodontist and they should work on straightening teeth. It can be an oral surgeon that focuses on removing impacted teeth. The dentist in the office comes in and does their work. They don't set up anything, they don't clean up anything. They usually do their treatment and then do their notes. The doctor works together with the hygienist to do exam. Once the hygienist needs an exam, the doctor will make time to see the patient to see if there's any cavities or any concerns with that patient. Administers nitrous oxide. The doctor is also the one that is writing the prescriptions to the patient. In some states, they allow hygienists to write prescriptions. The doctor has the most responsibility in the office, and the doctor is responsible for everyone in the office. Moving on to school and education. As a dental assistant, you can go to school and complete a program for anywhere from 9 to 11 months. Some states do not require the assistant to have schooling, as long as they're trained in an office and they have their certification for radiology in order to take the x-rays. For a dental hygienist, it is required that you go to school and obtain an associate's degree. It can take anywhere from 18 months, an accelerated program. I did an accelerated program, or anywhere to 4 years. Some people decide to do 2 years of their prerequisites and then they jump into a 2-year dental hygiene program. My accelerated program, everything was combined into one program. To become a dentist, you will have to do 8 years of college, 4 years of undergrad school, and then 4 years of dental school. If you want to go into a specialty, for example, to be an orthodontist or endodontist or oral surgeon, you will be doing an additional 2 years in your specialty, which is putting you at a total of 10 years of school. The cost of school for these 3 positions will depend on the school that you choose to go to and the location of the school. Dental assisting will be between $3,000 and $15,000. The cost of dental hygiene school will be between $22,000 and $80,000, and the cost to be a dentist will be between $120,000 and $425,000. I know a lot of people that want to become dentists, they work their way up to that. So a lot of people, what they would do is they'll go to school to be a dental assistant. That way they can become familiar with the procedures that a doctor does, learn instruments, learn dental anatomy before they are able to afford dental school. I think a dental assistant is a great way to introduce you to the dental world, because a dental assistant can assist a hygienist or it can assist the doctor. So for instance, I have an assistant at work as a dental hygienist, so that way my assistant will see everything that consists of hygiene. The next day they may assist the doctor, and that way they will see what the doctor does. Being assistant kind of exposes you to every aspect of the office, since dental assistants work so hard in the office and they're literally everywhere. But also it's a great way to see if this is even something that you would like to do. You're only spending about between $3,000 and $15,000 to complete your program. It's decent pay. You get to see if you want to put yourself in the debt to go to dental school. What if you jump in and you say, hey, I thought I wanted to be a doctor, but this is a lot, before you spend anywhere between $120,000 to $420,000 to be a dentist. Last but not least, the pay. I love helping others and I love what I do, but at the end of the day, it has to be worth it. Let's discuss the pay of each role and compare. So, as a dental assistant, you'll be bringing in on the low end about $13 an hour, and on the high end about $27 an hour. It's a salary of about $27,000 to $56,000 per year as a dental assistant. These different pay rates will vary depending on your location, and your confidence and your experience. Pay for a dental hygiene would vary. Most of the time, a dental hygienist won't work a full-time schedule, say Monday through Friday. They would usually work 2 to 4 days a week. Some hygienists do work full time, but usually it's a part-time job because of the wear that it has on the body. The low end for dental hygienists would be $35 an hour, and on the higher end for a dental hygienist would be about $72 to $75 per hour, which is a salary of $72,000 to $145,000 per year. Now, a dentist's salary is going to vary on their specialty, but the average pay for a dentist on the low end is $140,000 per year, and on the high end $400,000 per year. And I know some specialties such as oral surgeon can be on the very high end of about $650,000 per year. For comparison, you can make about $200 a day as a dental assistant, $400 a day as a hygienist, and $600 a day as a dentist. My pros and cons of dental assisting. A pro for dental assisting will definitely be that it was exciting. Like, you never know what you're going to get. Even if you're doing a simple fill-in, the doctor may drill down and it's like, this is worse than we originally thought. Now you're doing a root canal. But also, you got to see different procedures during the day. So you could do extractions. Next patient's going to be an implant. Then the next patient is going to be root canal. That was fun for me to see different aspects of dentistry on a daily basis. Another pro would be that you are able to help a doctor with their specialty. I feel like I am a great assistant and I am really good with helping others do what they do best. I was proud that I could be a part of helping this patient save a tooth, or helping this patient remove a tooth that had been bothering them. Some of the cons of being a dental assistant would be that you don't always work with kind doctors. As a dental assistant, you have to kind of be okay with being told what to do, how to do it. Some doctors are very particular. Even if you're taught one way to do something, if the doctor likes it another way, you have to learn it their way, and you have to be okay with that. You can't be like, well, this is how it's taught and this is how. It's like, no, you're here to assist, so just do what is asked of you. So if you don't feel like you're good with being told what to do, then dental assistant, you would not be comfortable in a dental assistant. A con would be having to deal with this person's mood swings. You work very closely with your doctor that you are assisting. You basically have to know everything they need before they even know that they need it. So if they're having a bad day, then you're kind of just like on the end of that. And sometimes it may be personal, sometimes it may not be personal, but you are working very closely with someone because you are their assistant. Another con is that the dental assistant has large responsibility, a large amount of responsibility. I mean, you are setting up the room, seating the patient, taking x-rays, assisting the doctor, cleaning up the room, dismissing the patient, and then starting the room up for a new patient. On top of everything else that you still need to do, like ordering, scheduling the next appointment, going over treatment plans, going over oral hygiene instructions with the patient, all while still having to maintain your doctor's schedule so that the doctor can be on time. You usually leave last, and the pay is not that well. I still, to this day, I don't understand why the pay for dental assisting is so low when if the doctor did not have an assistant, there's no way they can do the work that they need to do. There's no way. Pros of being a dental hygienist. Well, I would say a pro of being a dental hygienist is that you are considered a provider. You have a sense of importance in the office. If you like to work alone on a daily basis, you don't want to work under a doctor, no one telling you what to do, you are usually going to get the doctor just to do your exams. But besides that, you are usually on your own unless you have an assistant, and then your assistant actually helps you. They're breaking down your rooms, they're setting up your rooms, they're taking your x-rays. Another pro is that your doctor trusts you. You call the shots on what you know is best for your patient as far as gum disease treatment, what type of cleaning they need. You're usually looked at as like a higher status in the office. Transitioning over from a dental assistant to a dental hygienist, it was kind of weird because of the different treatment that I got in the office. Even sometimes the assistants treat me differently. There are some diva hygienists that are like, oh, you're the assistant, you do this. I'm not doing that, I'm a hygienist. And I know that because of how long I've been a dental assistant. There are some hygienists that are diva hygienists. When you're first getting to in an office and you're meeting everybody for the first time, they're kind of trying to feel you out and see, what kind of personality you have, or like, you do it, I'm not going to help her because then she's going to think I have to do everything for her type of attitude. But one thing that kind of made me feel weird a little bit. It's like the doctors are like, hey, they want you to come in the office and they want to talk to you and they want to know where you went to school, and then they want to tell you where they went to school. And it's like, as an assistant, no, they're not telling you that. They're not talking to you about that. They don't want to know where you went to school. They don't want to know what you know. They just like, this is what I need to do today. Can you do it? Okay, thanks. Be ready on time. Type of deal. But as a hygienist, it's like they're introducing you to the other colleagues. It's like you are looked at as a provider. You are respected as a provider, and rightfully so, because you go to school to have additional training so that you are able to be a provider. And then another pro is the pay. The pay is very good. The hours are very good. You, like I said, you usually don't work a Monday through Friday shift, and you still get a good paycheck. Some cons of being a dental hygienist. Number one con would be body fatigue. Your neck hurts, your back hurts. No matter how well you practice proper ergonomics, you're going to have strain on your body. So at the end of the day, your hands are sore. I have a hand massager that I use. You're going to usually need to see a chiropractor and have a massage at some point of the week or month as a dental hygienist. That would be my number one con. My second con would be that it's repetitive. You are not seeing different procedures every day outside of cleaning. So you may have a regular adult prophy, which is a regular teeth cleaning. Then you may have a scaling or root planing, which is still teeth cleaning. And then you may have a perio maintenance, which is still also a tooth cleaning. So you are just seeing different aspects of teeth cleanings all day. Pros to becoming a dentist, I would say, is number one, the pay. The pay is very well. You are paid. Dentistry is pricey. So if you're the doctor, you are getting a pretty good percentage of the treatment that you complete. Another pro would be that you're a doctor. You're a doctor. As a doctor, you have huge responsibility. You are in charge. You usually have multiple assistants to help you, and you usually can just come in, do your job, and then go home. A con would be just that also, the responsibility. As a doctor, you have a huge responsibility in the office. You are usually one, if there's any malpractice lawsuits against you, against your business, you are the one who takes the heat for that. You are responsible for your hygienist. You are responsible for your assistants. You are responsible for making sure that everybody is doing their jobs the right way, following all the protocol in the office, with OSHA and safety control hazards and all these things. You are responsible making sure that your office is running the way that it's supposed to be running. Another con I would say is a personal con, is that you are working with different materials that may contain mercury. Has been proven to cause Alzheimer's, dementia. And when amalgam fillings were done more frequently, there was lots of studies done, and a lot of people believed that working with the mercury that are in amalgam fillings caused a lot of dentists to commit, and also the high stress levels. With any job, you're going to have stress, you'll have pros and cons. It's best for everyone to just kind of get in there and form an opinion for themselves to see if working in a dental office is something that you like to do, if you like to be around others, if you like to help people, if you don't mind seeing blood and spit and sometimes vomiting from people having gag reflexes, then I think you would enjoy a position in the dental field. I hope you guys enjoy this video, and I hope it helps you determine which position you would prefer in the dental world. And thank you for watching.